Hi class, this video is going to be covering the blood vessels that we learned in lab. We're going to start at the aorta on the heart model. Remember, here is the aorta. This portion coming out of the heart is the ascending aorta, and this is the arch. Now on the posterior side, this would be considered the thoracic aorta because it's traveling back behind the heart in the thoracic cavity. If we look on this model, the heart's in the way, so it would be behind that. But as we come down underneath the diaphragm, which is here, we can see this is the abdominal aorta. Now, off of our aorta, remember we have our coronary arteries. Here's the right, here's the left. And then off of the arch, we have three main vessels. At the top right is the brachiocephalic trunk, left common carotid, and left subclavian. Since these are kind of just cut off, let's look at the model here. So we can see here, under here where it would be red, is going to be your brachiocephalic trunk. And then we have a right common carotid and right subclavian. Straight off of the arch is the left common carotid up into the neck, and then the left subclavian over into the arm. Now, as we go down into the abdominal aorta, we have the abdominal aorta branches that are on our list. So I'm kind of going through your list here as I'm... Actually, before we get to the abdominal aorta, let's do the neck and head. So we have our common carotid on the left, and over here in the back of the neck, this isn't the greatest picture. This would be the vertebral artery. Remember, vertebral artery is going up through the holes in the cervical vertebrae. Here we have our facial artery, and then this is the superficial temporal artery as well into the head. Now this model does not show us the deeper vessels that go into the base of the brain. So for those, be sure to use your book. And if we look at the image here, what we're looking at is this is the vertebral arteries that is coming up together, and then they make the basilar artery here, and then this circle portion is the circle of Willis. That's really all you have to know on that list. Now, okay, so that is in the neck and head and into the brain. So now let's go into the arm, and then we'll go back to the abdomen. So we had brachiocephalic trunk on the right, left common carotid, left subclavian. So the subclavians are going to kind of follow out here near the clavicle. As you travel down the vessel, when we're near the armpit, now it's axillary artery. Then as we travel down into the arm in the humerus area, this main vessel is the brachial artery. There is a deep brachial, which is showing here, and on this model over here, it's going to be this one. Then we go down into the forearm, and we're going to use this side because we can see he has his palm up. So again, subclavian, axillary, brachial, deep brachial, and then we have radial and ulnar. I'm pointing to all the red vessels now because we're doing arteries in the systemic system. Okay, that is the arm. Now let's go back to the abdominal aorta. And here again is our diaphragm. We're looking at this really little like point or stump right there. See that? That is the celiac trunk. Celiac trunk is a vessel that comes off of the heart, or off of the aorta and branches. So on this model, this is our urinary model, but we can see, you know, there's the kidneys, this is the aorta, this is the inferior vena cava. So here where this hole is, that would be the celiac trunk. Okay, now the vessels that come off of there, we have in our book, we can see those images. There's the celiac trunk. This is the left gastric artery that's traveling up to the stomach. But on our model, we don't see the gastric, but we can see the splenic and the hepatic. So the red vessel going over to spleen is the splenic artery, and the red vessel going over to the liver is the common hepatic artery. We also have two mesenteric or mesentery arteries. The superior is this one. If you follow it down, goes to the colon here. It is right at the top, right below the inferior mesenteric, or excuse me, right? I'm sorry, that was confusing. The superior mesenteric is right below the celiac trunk, right here. Now if I go back here, we can see celiac trunk, and then this vessel is the superior mesenteric. These are the renal artery and vein. They just go straight across. And then at the very bottom here, this bottom one is the inferior mesenteric. If we look over here again, we see celiac trunk, superior mesenteric, and then inferior mesenteric. It's coming over to the colon here. Those are a little trickier to see on the video, I'm sure, than in person, but hopefully you get an idea of where those are. Now, as the aorta, abdominal aorta comes down, now it's going to be like a wishbone. It's going to split. And this area here, right here, here to here, is the common iliac artery and vein is underneath it. There's also an internal, where it's tipping in. That's the internal iliac and vein. And then this portion would be considered the external, just to the brim of the pelvis or the edge of the pelvis. So common, internal, external iliacs. Now, as this vessel comes out of the leg, we can see it better over here. Now this is the femoral artery. It's going to travel down. We also have the deep femoral artery here. Behind the knee is going to be called the popliteal artery. Then we have the posterior tibial, the anterior tibial. Here you see it here as well. And then the dorsalis pedis is kind of where you tie your shoes, right at the top of the foot. Those are the arteries. Now let's go into the vein list. And we can start in the pelvis again. So again, you have your common iliac vein, internal iliac vein, external iliac vein. Now, as the vein comes down, there is a femoral vein, but there's also a big vein you can see there going all the way down the leg. That is the great saphenous vein, all the way down. Great saphenous, oops, right here, great saphenous. The femoral vein is going to be here. That's the one we have there. And there is a deep femoral vein as well, which branches off. If we look at our list here, or our picture, we can see it's there as well. A little harder to find on the leg model. There is also really the popliteal. It's going to be on the image here, as well as the posterior and anterior tibial veins. The model really just shows the great saphenous and the femoral vein for the leg. Now, our common iliacs will dump into the inferior vena cava. That's what this all is. Here's our renal veins going straight over to the kidneys. And we do have a gastric vein. That would be an image listed in here. The splenic vein is going to be more the purple one here. And the hepatic vein is the blue one. Now the purple on here coming to the liver is the common, the hepatic portal vein. Okay, now let's go up into the upper body. So we have the superior vena cava, and here's a left brachiocephalic and a right brachiocephalic vein. Remember, we just had the brachiocephalic trunk with the artery, but here we have veins, left and right. And instead of, remember, this is common carotid, the red one. Instead of a carotid vein, this is called the jugular. So in the neck, the jugulars are kind of one after another. They don't split. It's just two coming off of that brachiocephalic vein. So here, the bigger one is going to be the internal jugular vein, and then this one outside here, this one, is going to be the external. So that is the jugulars. Then when we go into the head, now there would be a vertebral vein there too, but that's not on the book, so that's in here. Here's our internal, external out there, and then vertebrals traveling through the vertebrae. Now notice this thing here, this big loop is called the dural venous sinus. That's something that's on your list as well. Okay, now into the arm. So similar to the arteries, the veins are going to be traveling through the subclavian. So we have our subclavian matching our artery. Then once it's in the armpit, this is axillary. This one here, out here, this is going to be cephalic vein. Now, as the axillary comes down, it branches. We have a branch here and this one here that's kind of broken off or just cut off. That is the brachial vein, and this is the basilic. Now, as we go across the elbow, see this diagonal vein? That's the median cubital vein. And then usually I label this as the radial vein and this is the ulnar vein. Kind of following the arteries there. All right, let me double check the list here. I believe that is everything, class, that is on our word list for fall of 2021, or yeah, 2021. Okay, so be sure to review this a few times. Use your lab book because we will use those images for the quiz, but the models and images will be on the practical. Thank you.